Hi, everyone. It's Arundhati, and welcome to episode 200 of the Let's Talk Yoga podcast. It's officially October, and I hope you are having a wonderful start of this season. I have a conversation with Andrew McGonigle on the show today. And Andrew is someone I discovered on Instagram. He's usually known as Dr. Yogi on Instagram. He actually was training to be a doctor and then slowly moved away to teach yoga, become a massage therapist and anatomy teacher. He has been studying anatomy for over 20 years, and he combines his skills and experience to teach anatomy and physiology of yoga in courses worldwide. And he also runs the Enlightened Yoga Collective, which is an education-based online community membership program for yoga teachers. He's an author and he's written 2 books. His first book was Supporting Yoga Students with Common Injuries and Conditions. It's a handbook for yoga teachers and yoga teacher trainees. And that, I believe, came out in March 2021. And then his most recent book is The Physiology of Yoga that was published in June 2022. And Andrew lives in Los Angeles with his husband, and I've been following Andrew for many years now. Andrew and I are talking about pain and inflammation on this episode. We've done 200 episodes and we haven't touched these topics yet. And I haven't really approached these topics because there is so much that can be said and needs to be looked at when we talk about pain and inflammation. So Andrew breaks down for us very clearly what is pain, what is physical pain, what is psychological pain, the role of the nervous system, the role of lifestyle and mindset, research studies. He has such wonderful research studies that he shares throughout this episode. We look at what does this mean for a yoga teacher who walks into a class not necessarily knowing the medical history of a student. And if they say they're experiencing pain, how do we encounter this in a wholesome way, and what it means to age with a body that experiences pain. And there's so many more layers to pain. We also transition to inflammation, and we talk about what is inflammation, the different types of inflammation, and how do we use yoga to combat inflammation. And there are so many tidbits in this episode that I hope you will take into your practice and into your life. I really hope you find this conversation useful and that you are walking away with some amount of clarity and certainty about pain and inflammation. Okay? As always, if you enjoy the Let's Talk Yoga podcast, feel free to rate and review this podcast. Your support is what helps us continue so we can go from 200 episodes to 500 episodes. Enjoy this conversation with Andrew McGonigle. I'll see you on the other side. Hi, Andrew. Welcome to the Let's Talk Yoga podcast.
Oh, thank you so much. It's so great to be here. I'm excited to be number 200. It's amazing.
I know, right? And I can't believe we are at episode 200 myself. And while the 200th episode should be something celebratory, you and I are going to celebrate by talking about pain and inflammation. I mean, I think these are exciting and relevant topics. So to kick things off, how would we define pain? And are we only talking about, say, physical pain? Because these conversations come up in yoga spaces all the time. And it is very common for a student to say, that hurts. So how would you define pain?
Yeah. So it's typically defined as an unpleasant sensation. The most important thing to understand about pain that most people don't realize is pain is an output from the brain. So pain isn't something that your body or nervous system are detecting, but it's actually something that your nervous system is creating. So that's something I think sometimes for people, it's a bit of like a light bulb moment. Mm-hmm. So for example, if you were to put your hand on a hot stove top, you're not feeling pain. What is happening is receptors in your fingertips are feeling the extreme heat. They're sending an impulse to the brain that then creates a pain impulse so that you pull your hand away from the hot stove top. So that's something it's important to understand. And so basically, pain then is a neurochemical impulse coming from the brain out to the body, really giving us information typically about our environment, whether that's internal or external. So yeah, so I think that's something interesting. And then there's a difference between what we call acute pain and then chronic pain. Now, again, the definitions for these vary depending on the source. Typically, acute pain is pain that you're feeling for less than 3 months. Okay. Then chronic pain is typically described as something that you're feeling for greater than 3 months. Okay. Now, I don't love the term chronic personally, because chronic really means permanent. And as we know, nothing in life is permanent. You know, we're either wanting to make things that feel fleeting more permanent, or we're wanting to make the things that feel like they're always here kind of move away. And that's just not how life works. So I prefer to use the word persistent, because even if you are feeling pain for longer than 3 months, you're going to have good days and you're going to have bad days. You know, you're going to have moments in a day where you don't notice it, and other moments where it feels more severe. You're going to have things that trigger it and things that relieve it. So it's basically like a wave. There are peaks and troughs. So it's not this like permanent thing that's always necessarily going to be there. It's just, I like that idea of like persistence rather than chronic, because the term chronic makes people think I'm always going to have this.
Yeah. And
you know, so I think that this is where language is so important.
For yoga teachers who sometimes walk into a yoga space and they don't know the history of a yoga student and what they're experiencing, is there any specific general questions you would encourage yoga teachers to inquire about, especially if they don't know the students in front of them?
Yeah, so if you are asking about someone's general health and someone mentions something like osteoarthritis, or they mention something like they have a prolapsed disc, I think rather than fixating on that actual terminology and that diagnosis, it's more about finding out what that person's experience is today. Because someone could be diagnosed with a prolapsed disc, but they currently have absolutely no back pain. And there doesn't seem to be anything that triggers it. So I think, and it's similar with osteoarthritis, you can have days that's very bad and days that feel quite good. So really, it's about finding the questions that help you understand like how someone is doing in this moment, and then asking that person, you know, how can I support you today? Because sometimes it's interesting. I've noticed that when I've gone to class, I've sometimes overheard a teacher's reaction to someone sharing something about their health, and sometimes we can kind of feed into the narrative that someone has about their body. Like if someone comes to say, oh, I have, 2 prolapsed discs. I've heard a teacher go, oh my goodness, it sounds awful. Like it's amazing that you've shown up today.
Oh,
and
wow.
Actually, instead of that, it's, saying something like, I really appreciate you sharing this with me. How are you doing today? How can I support you best in this moment? I think it's a really important thing, because we've talked about the physiology of pain in terms of what actually happens, say that when we put our hand on the stovetop. But what we haven't talked about is the kind of psychology of it, because there's a huge psychological component to pain. And really our mindset and our language, the language we use maybe to describe our body or to describe the experience we're having, has a huge impact on the way we might experience pain. Okay. So if you're someone that tends to have a more positive mindset, research tells us that we're going to experience less pain potentially.
Oh, really?
Yeah. If you have a negative mindset, you're more likely to experience more severity of pain or pain for longer. It's really interesting. If you're the type of person that catastrophizes, so essentially making a mountain out of a molehill, then that's going to affect your experience of pain. The words we use to describe our body. So if you have issues with your knee and you have knee pain, or you've been diagnosed with something like arthritis, if you're saying things like, oh, my knee's screwed, or, then if you're using that kind of negative language to describe your body, then you're probably more likely to have pain for a longer period of time. It's really fascinating. And there's some research that looks at the language that medical professionals use. And if you were to say you were experiencing pain or dysfunction in your body and you were to go for a scan, if you're told that you have degeneration or abnormalities, which is very common language, it is changing. If you're told that, you're actually more, it's going to take you longer to feel better compared to someone that is told, oh, these are normal age-related changes. So the language is so important. It can literally change someone's entire experience. And thankfully, the medical world are shifting now and getting rid of language such as degeneration and things like that. And they're using this term like normal age-related changes.
I also think as yoga teachers in these rooms, it is the responsibility to create that safe space for that, very safe sharing of, hey, this has happened with my body, and you remain very neutral to compassionate in how you respond. Because of course we have liability forms and we ask people to share if anything has that we need to know about before teaching, but not many people do. So many times people will just think it's not significant enough to tell you that their back spasms every now and then or something else. And I think it's also the responsibility of the teacher to create that very safe environment where they can privately share with you and you don't make a big deal like, oh my God, you're still walking into class here. Yeah, that would just, you dig a hole and bury yourself in it at that time. So speaking of pain, is pain always a direct indicator of tissue damage or some other bodily injury?
It's such a brilliant question. In the past, the science world and the medical profession used to really believe that there was a very, very strong relationship between tissue damage and pain. So, for example, if you were experiencing pain in your shoulder, the belief was there's something wrong with the tissues of your shoulder and we need to do something about this. And very typically, people went down the route of having surgery. There were then some really amazing kind of landmark studies done that really changed our whole perception of this. And on various parts of the body, let's talk about the lower back. Lower back pain is like super common. It's probably the most common of all the pains in the body. So there were these landmark studies that basically gathered together groups of people that were not experiencing back pain, and they put them into categories depending on their age. So let's say 20s, 30s, 40s, up to 80s, 90s, and they all had detailed scans, and a large percentage of people with no back pain were found to have prolapsed discs, and the incidence increased with age. So what they realized is it's very possible to have what in the past would have been deemed a source of someone's back pain. It's possible to have that and have no back pain. And because they clearly saw that the incidence increased with age, they realized that this is just a normal part of the human aging process. So it doesn't mean that it's not possible to have a prolapsed disc in your spine and to have back pain, but it's also very, very possible to have that and be none the wiser, to go through your whole life and not know. And then there was other research that also tells us that these things can spontaneously resolve. So up to 50% of cases, people's herniated discs spontaneously resolve with conservative treatments and without surgery. And the fascinating thing is they found that the greater the herniation, the greater the chance of spontaneous resolution.
Oh,
so
really?
If you are scanned and told that you have a herniated disc, you want to hope that you have a really big one because it means that you've got a greater chance of it spontaneously resolving. So in the past, if you were scanned and you were told, oh, you have a herniated disc, it's like it was presented to you as if, okay, this is the root of the problem. And we're now realizing it's way, way more complicated than that. It's similar with knees. There's been these amazing studies that gathered people together that had no knee pain in different age categories, and then they x-rayed them. And a reasonable percentage of them were found to have changes in the knee structure that would typically contribute towards someone being diagnosed with osteoarthritis of the knee. But these people had no knee pain or dysfunction. So again, we're recognizing that these changes in the body are part of this normal aging process that we all have to go through as humans. If anyone comes up with a way to not age, please let me know. I will sign up to that.
It's called
So
yoga.
yeah, so it's called yoga. There we are. So this is the thing. So basically, what this knowledge did was it basically helped us to help the science world, the medical world, to create a new model for looking at pain, and it's called the biopsychosocial model. So yes, there's biological elements to it. There could be tissue damage. It could be a genetic thing, a family history of something, but there's psychological issues. So it could be mental health, could be playing a role, stress. It could be your socioeconomic status. It could be financial
lifestyle.
worries, lifestyle, could be diet. And what's beautiful about this is instead of just focusing on tissue damage, it's looking at a holistic view. It's stepping out and looking at that entire person. And then when you take that more holistic view, you're more likely to actually find the issues that then can be addressed. So one of the ways that I personally like to think about pain is that if you think of all the stressors in your life at the moment, okay, you might have physical stressors, you might have these psychological stressors. We talked about the social stressors. If your perceived ability to deal with those is low, then you're going to likely end up experiencing pain as a result. That's one way of dealing with it. So basically, the beautiful thing about the biopsychosocial model is it helps us to tackle pain in a better way, because a lot of people were having surgery for these specific issues, and they just weren't improving at the rates that people hoped. So, and now that we're able to take this more holistic view, we're able to help people get out of pain more readily, which is pretty exciting. So yes, this biopsychosocial model is a game changer in the science world, in the medical world.
It's the first time I'm hearing that. So thank you for sharing it in such detail. It reminds me of two things. One is a couple of years ago, I tore my ACL and had ACL reconstruction. And I remember very clearly that, in America, they just give you very heavy pain meds, narcotics to be precise. And I remember my surgeon had prescribed some intense level of, I forget what it was, but some narcotic. And to a point where the pharmacist also was like, every 2 hours you want to take 4 pills? That's a lot. Something like that. It was crazy. Even they flagged it and we had to call the hospital and all of that. But I barely had any pain post-surgery. So I refused to take it. And the surgeon could not believe it that I went off of it a day after surgery, because I was like, hey, this is very low-grade pain and leg is immobilized and I can manage it. It was surprising to me too, because I've not broken anything before. So this was my first surgery and I was expecting to be in some amount of pain. And just that the fact that the level of pain that I thought I would experience physically and what I actually ended up having was very different. And I do think mindset had something to do with it. Just I now when I hear you speak, I look back and almost had a painless recovery. There was some pain, but it's totally manageable. And another thing when you spoke about the knees is I was born and raised in India. I spent a good 26, 27 years there. And something I would notice, and I even noticed this summer when I went back, was everyone there has knee pain, especially women. And it's something, and you'll see women, especially perimenopausal, menopausal women, you will see they will walk with a slight limp. And it's amazing to see how, especially in the South, most women have that. And it's almost like you expect to get it. There are also lifestyle factors. You don't climb stairs as much. And even the stairs you climb are very small stairs, and you're walking on a flat path. So you're not really doing incline, decline. You're not squatting as much. You have a lot of help at home. So you're not really doing any very hard manual labor unless that's your job in many ways. So it's just everybody has knee pain, and it's largely lifestyle. And sometimes you may not even have any structural issues. You just think you have knee pain because every other woman around you has knee pain. And it's something we talk about, like friends of mine, we talk about it, like especially yoga friends. We're like, how do we fix this? everybody in the family just has knee pain. And those two things, I mean, there's no real question here. It's more an observation.
Exactly. And how like mindset is just so important, and also your expectations. So if that's the way that you see people around you age, that's likely the way that you're going to age unless you change the way you think about it.
Because then you just think it's going to happen to you too. And this is just, I mean, I don't think in your 40s you should be limping or anytime, but, and you think that till 85, it's okay to live like that. And so, no, I think that's a very, go ahead.
Yeah, in Ireland, we say, don't let the old person in. And I don't mean don't let them into the house. They're knocking. But it's just like the idea of, there's also a psychological component to age. And yes, of course, we all age. But you can change the way that you view aging. And it has an impact. There's also the studies on this. It's absolutely fascinating. There's studies where basically they took a group of people, let's say in their 80s, and they basically reconstructed what their life looked like 2 decades before, let's say in their early 60s. And they were encouraged to live life just like they had been. And a lot of them, with all their health parameters improved over a period of time. They basically like aged backwards because there was this mental reset, and maybe also because they had to change their lifestyle as a result. So I think, yes, we all age, but we also get to decide like how we age. And I'm grateful that we're of a generation that now have access to all this amazing information, because I think for older generations, there's an idea of, I get to slow down now. I've worked my life. And yes, of course, you get to relax and de-stress and have a different lifestyle, but we need to stay as active as possible. And actually, for all types of pain, physical activity is one of the best medicines. And this is proven by science very, very thoroughly. Physical activity is the best way to manage pain. So lifestyle is so important. Yeah, so that's a really, really interesting observation you had.
No, I think what you say, right? Lifestyle is so important, and especially today, right? Like my grandmother didn't have access to this. My mother probably didn't have access to all of this, but we have access to so much. So it should sometimes be easier for us. But in a yoga class, how do yoga teachers recognize the difference or help students recognize the difference between, say, good discomfort, because putting your bodies in certain positions and putting some strain on them is extremely beneficial, and how do we get a student to recognize potentially this is more bad pain?
Yeah, I think, it's a complicated topic. I think because, to start off with, everyone has different pain thresholds, don't they?
Yes.
And for some people, just a slight twinge or even a stretch can feel kind of uncomfortable. Yeah, I think in a yoga setting, I would encourage students against feeling very strong sensation. So if something feels really strong, I think it's advisable in that setting to back off a little bit. Okay. But here's the nuance of this. If you're working with a physical therapist, there's research that tells us that if you experience pain during the sessions, you're more likely to rehabilitate more quickly. Okay. So pain in itself is not a bad thing. And particularly if you have students who are experiencing persistent or chronic pain, just because they have pain during a yoga class, it does not mean that more tissue damage is happening. Yeah. So pain is not this black or white thing that's kind of good or bad. But in a yoga setting, I don't think it's the place to be pushing people beyond their comfort zone. I think getting people to explore that boundary can be helpful. So I wouldn't even necessarily talk about pain specifically, but I would say if you feel any strong sensation, you have permission at any point to back off, to lower the intensity, to slow down, to take a different option, to rest, whatever it is. So yeah, it's an interesting one. And then also reminding people that it's very normal after a yoga class, maybe that evening or the next day, to also feel discomfort in your body, particularly if you haven't practiced in a while, or you're practicing at a greater intensity than you're normally used to, or you're practicing new poses or new variations of poses. It's very normal for our body to feel some sort of pain or discomfort, and it doesn't mean that anything bad has happened. It's a challenging one. Obviously, we know that yoga is way more than a physical form of exercise. We know that. But looking at it just as a physical form of exercise, there is a risk of injury that comes with that, with every form of physical activity. Now, the good news is yoga is very low risk, particularly compared to other forms of physical activity. There's a lot of research that backs this up. Because really, in order to injure our tissues, we really need a combination of velocity and load. So speed, there needs to be some sort of speed, and then there needs to be a load. A part of our body needs to be stressed in a way that it's greater than it's been trained to deal with. So this is why a sport like skiing or playing football or soccer or netball or something that's dynamic, that has a lot of speed to it, that involves a lot of like load on the body in different directions. That's why things like that have a way greater risk of injury. Yoga, even if it's a fairly fast form of vinyasa,
you still, gentle.
The chance of injuring yourself is low. It doesn't mean it can't happen. Now, I have injured myself in a yoga class before. It was actually from a physical adjustment. It was someone applying force to my body. Someone actually, who had never met me before, adjusted me in lotus pose, and I sprained my ankle. So it doesn't mean that things can't happen. Someone could maybe topple and fall over. Like, it's life. We can't wrap everyone in cotton wool. So I think we have to take all of this into account. And yes, we don't want people in class feeling strong sensation, feeling pain, but it's not always within our control. And in some cases, even if it does happen, it doesn't mean that tissue damage is occurring, if that helps. I think it just helps yoga teachers get out of that fear place, because I think it's understandable. Don't teach from fear. And I think it's difficult, because I think, we have ahimsa, we talk about ahimsa, which is no harm. I think sometimes it's taken very, very literally. And I think yoga teachers can think, I need to protect my students. I need to wrap them in cotton wool. Now, we can actually inadvertently cause harm because of the language we use. Okay, so there's something that's called the placebo effect. I'm sure many people listening are familiar. If you had high blood pressure and I gave you an M&M, but I told you this is the latest, most effective high blood pressure medication, it's just sugar. I give it to you every day, and I measured your blood pressure after a week. Your blood pressure will lower because you had a positive expectation. So it comes back to the psychological element that we talked about. Now, the opposite is also true. It's called the nocebo effect. So if I was to give you an M&M and I told you this is cyanide, but you have to take it, but at the end of the week, you would have symptoms of being poisoned.
Oh, wow. Okay.
So it's basically a negative expectation of an otherwise harmless event can lead to a negative outcome. This is proven by science, millions of times. So as teachers, if we're in this fear-based place where we're worried about our students injuring themselves, we could be teaching a warrior pose, and we could say, keep your front knee above your ankle to protect your knee joint. Okay. Now, a student could be in warrior. They could be completely happy thinking about what they're going to watch on Netflix that evening, and they look down at their knee and their knee has moved beyond their ankle. They could actually experience knee pain in that moment. Not because there's tissue damage happening. Being able to move your knee beyond your ankle, it's a normal movement. You wouldn't have been able to get out of bed today or climb a flight of stairs or get in and out of your car without taking your knee beyond your ankle. Okay, so no tissue damage has happened, but the expectation, the nervous system hears the word protect, and there's like a red alarm going off, and we can actually experience knee pain as a result of that language. But the other thing that can do is it can instill this narrative in our students that their bodies are fragile, and they're not. Our bodies are anti-fragile.
Yes.
Our bodies respond positively to stress, as long as that stress is kind of given in a progressive way that we're able to kind of adapt to. So, yeah.
It reminds me of, I think, because in yoga classes, we have so much of language, right? We cue, we communicate. It is more verbal than many other formats. And it's like if I went to a swim class and the instructor constantly said, don't do this or you'll drown, do this or you'll drown, don't do this or you'll drown. It would just, who would go back to that? So it's, when we sometimes take ourselves out of the yoga context and explore this in a different setting, it lands differently. And
And there's
Something
always
I,
good intention.
it
There's
is,
always
it
like
is.
no one's there wanting to cause harm to people, but it's like we just need to find that place on the spectrum where
Mhm,
it's not like I don't want people to care less, not care at all, and just let the
mhm,
students do whatever they want. But it's like find that midpoint somewhere
mhm. It's
where
like
you have
how
that
you said,
compassion.
mhm. It's like how you said sometime back that let the student explore and find their own boundary and let them explore what that feels like. I think that's such an important thing because otherwise you're putting all these barricades before they even get to that. Something I've used in the past in classes is, especially if the student is new and if they say it hurts or that's painful, I'm like, my first question is it uncomfortable or is it discomfort or is it that sharp, pinching, throbbing pain? And is it mild or moderate? Do you think that because it's unfamiliar, it's a new sensation? And I encourage them. I'm like, try it again if you feel like you can or want to, and and then see if it's just a different experience. And I always tell them if it lasts after this class, the next class, if it's still there, then we address it. But is it just new? And 99% of the time, it's just new.
Yeah, I
And
love
because they've
that.
not held a plank. And so that effort is labeled
Yeah.
as pain. That discomfort is labeled as pain. So yeah.
Yeah. And also that's beautiful because that you're then taking people on a journey where they start to understand the things they're
Mhm,
feeling.
mhm. Also say things like, here's how you take the load off the plank. Put your knees down. Get to tabletop instead. Here are other ways we can work. So there are always many different exit points, but they get to decide what that exit point is.
Yeah, I love that. It's beautiful. It's
Mhm,
beautiful. Because I think often when people are new to yoga or maybe new to doing any kind of mindfulness kind of practice or a practice where you kind of really want to be in the present moment, I think, first of all, they don't know what they're feeling.
mhm,
And then they might get to a point where they realize they're feeling something, but they don't know what it is. And then
mhm,
eventually they get to label it. And it's like this beautiful like building of awareness over time.
mhm,
And we have to start people somewhere. But if
mhm,
we are always telling people what to do and how to feel, then they're not really going to go on that journey. And I think that's why asking questions and putting the onus back on students is so important, so helpful.
mhm,
And
mhm,
then they're going to have more kind of confidence to also practice on their own. And we want people to be practicing more and more yoga. So if they're constantly relying on us in every moment, to guide them, then I don't really know how much that is actually helping them in the long run. So
No,
it's an
I'm
interesting
with
one.
you on that. To not teach from that fear base, but to teach more from clarity and instilling confidence and building them up and recognizing what do they not understand about this specific thing and how can you deconstruct it to build those layers of understanding. Like how if there was a child in the room, you would break something down and simplify it. I think sometimes we as yoga teachers need to also work more on keeping things more simplistic in our approach. The answer is not don't do it. The answer is probably three other questions and a slightly different approach. So continuing to speak about pain, what role does the nervous system play in either amplifying this or sometimes even suppressing and quietening those pain signals? Because we have people who, and I'm doing air quotes, push through the pain when they're not supposed to.
Yeah, it's a huge part. Like the nervous system plays such a huge role in our experience of pain. And I think, if someone is experiencing persistent pain, they can probably recognize that when they're feeling stressed or when they haven't slept well or when they've had an argument with their partner
Mm-hmm.
or when a bill comes in that they forgot about and suddenly feel, overwhelmed financially, these are the things that can end up amping up their pain.
Mm-hmm.
And then when we're able to do all these amazing practices, pranayama, meditation, yoga,
Mm-hmm.
being in nature,
Mm-hmm.
all the wonderful things that make us feel more centered, more connected, more calm, this can often down-regulate
Mm-hmm.
pain. So I think this is really, it's so special. I see this as a toolbox. I see all these practices that I've been cultivating over the years as a toolbox that I can dip into every day to help me feel somewhat balanced.
Mhm.
And sometimes experiencing pain can be information. It can be information that maybe you need to slow down a little bit, you
Mhm.
know? Maybe you need to take an evening off and instead of watching Netflix, run a bath, do a
Mhm.
meditation. Maybe you need to have more meaningful social interaction.
Mhm.
So call a friend or book in a coffee with someone and have that connection, you know? So it's, I think, again, I don't want people to think of pain as this like negative thing because often it's just, it's giving us useful information. It gets us to stop and go, okay, what is happening right now? So for example, the other week, I was sat on the sofa and all of a sudden I felt really sharp lower back pain.
Mhm.
Okay. Now, rewind 10, 15 years when I didn't know as much about pain science, I might have bought into that and I might have thought, oh my God, what's happened? I've put my back out or I've slipped a disc or I've done something. I probably would have fed into that. And there's a good chance that I would have experienced back pain for some time.
Mhm.
I probably would have gone, oh, I can't go to the gym tomorrow, or I need to slow down my yoga practice, or I need to go back to bed or something.
Mhm. Mhm.
But what I do now with all the information I have is I go, okay, I need to check in with myself. Like, what is going on for me today?
Mhm.
And then things come up, you go, you know what? I am stressed. I didn't realize it, but I'm feeling really, really overwhelmed because I've got this scary podcast interview tomorrow. You know, I'm going to be asked all these questions about pain. And then like more often than not, then I'm able to shift out of that. You know, yes, I maybe feel sensation in my back for the next hour or something, but then before you know it, I've forgotten about it and the pain is gone. So I'm not trying to say that it's always in our head
Mhm.
because I don't want to invalidate anyone's experience, but again,
Absolutely.
it's this psychological
Mhm.
element to it. It's so important. So if you can help to regulate your nervous system where possible using these tools that we have at our disposal,
Mhm.
then it is definitely going to help you with the kind of experience you're going to have for
Mhm.
sure.
Mhm. Mhm. No, I think it is so potent to just sit with that pain and explore it and address it in wholesome ways. And I think back in the day also, I remember when I was very young and if my grandparents had any pain, the doctor would actually say back in the day, go rest, stop doing this. Sometimes even PTs, the first thing the physiotherapist will tell you is stop doing everything. And but I'm glad that we're at a point in time where we can explore this a little more fully. And so that brings us to inflammation. Okay? And correct me if I'm wrong, pain and inflammation often show up hand in hand. And but are they the same thing? Like sometimes there's that phrase, right? It's two sides of the same coin. So what is inflammation? And is there a difference in the short term versus long term impact of inflammation?
Yeah, sure. So great questions. So pain and inflammation are often linked,
Mhm.
but they are technically different things. Okay. So inflammation is produced by your immune system. Okay. So acute inflammation happening in the short term, it's vital actually for our survival. So again, it's not, don't think of it as a black or white, like good or bad thing.
Okay.
It's part of your innate immune response. So it's this very non-specific but rapid response that we have that helps to keep us healthy. Okay. Helps to keep us protected from pathogens. Okay.
So it's like a wound that swells up, right?
Exactly. Yeah.
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 Okay.
You get your redness, you get your
Uh-huh.
swelling, you get your pain often
Mhm.
associated with it. So even think of your nose running. Say
Mhm.
you're outside and there's some pollen or something, your nose runs. That's all part of your innate immune response. Tears, saliva, your hair, bodily hair, gastric acid, bile, your
Mhm.
skin, all this is all part of your innate immune response. Okay.
Mhm.
So I'm sure most of us have had some sort of allergy or hay fever symptoms at some point in our life, or maybe like a mild cold.
Mhm.
That's your innate immune response trying to clear the
Mhm.
pathogen from your body. Okay. So this is where I have a problem with people making kind of generic statements such as, oh, yoga boosts your immune system. Okay. Because if that was the case, yoga would also be boosting your innate immune response and you would feel permanently unwell. You would feel like you had allergy symptoms all the time, and you'd end up feeling pretty depressed. So this is an interesting one. So we'll come back to this, because this is acute inflammation. Then unfortunately, what can happen similar to pain is inflammation can end up staying around in the body way longer than we need it to, and it becomes chronic again. I don't love the word chronic. I would rather say persistent. It's the same thing. Mm-hmm. And this could be because your nervous system isn't fully regulated. It could be to do with lifestyle again. It could be because you have a sedentary lifestyle. You're not active enough. There's a lot of elements. It could be to do with dietary things. It could be to do with infections you have. But basically, this inflammation stays longer. And if you've had inflammation in your body, you're going to feel pretty rubbish. Like, you're going to probably have brain fog, lethargy, generalized pain, discomfort. Yeah. So this is basically what it is. So acute inflammation, vital. We wouldn't be able to survive without it.
Okay.
Chronic inflammation, we don't want it. Okay. There are so many conditions that have a chronic inflammatory component to them. Okay. So think of inflammatory bowel disease. Yeah. Think of rheumatoid arthritis. Yeah. Even osteoarthritis. We've talked about this a little bit. So in the past, osteoarthritis was viewed as a wear and tear condition. Okay, it was, the belief was that from physical activity over the years, let's say your knee joint, for example, begins to wear down, and then eventually you have bone on bone, and you get pain and dysfunction. Okay, now we mentioned some of this research because it's actually possible to have those changes on an X-ray that would typically help you be diagnosed with osteoarthritis. It's possible to have those X-ray changes, but to have no pain and dysfunction. So what the research particularly over the last decade has told us is the main component of even osteoarthritis is inflammation. It's low-grade systemic inflammation, so that means inflammation throughout the body that happens to be showing up in certain joints for certain people. It's a little bit of a mystery as to why that is the case. But the exciting thing is that then that gives us a way to tackle this. Okay, so rather than thinking, okay, it's a wear and tear condition, it's only going to get worse, or it's now permanent, inflammation can shift in the body. So if we're able to tackle inflammation, then we can help our knee osteoarthritis feel better. So that's the exciting thing. And one of the main ways we can do that, similar with pain, is through physical activity. Okay, your nervous system is amazing at conserving energy. So if you're physically active on a regular basis, this is recognized by your nervous system, and it begins to conserve energy to give you the energy each day to be physically active. And the easiest way that it can do that is by reducing inflammation in your body. It reduces inflammation, and then you end up feeling better as a result. So if you can progressively increase your physical activity over time, it's going to be the best thing to reduce inflammation in your body. Yoga plays a role here. Yeah, yoga is wonderful at reducing systemic inflammation in the body. There's some really robust science that is emerging that is telling us this. Okay, but the good news is that, most people here are listening because of yoga. But if you have someone in your life that has inflammation and maybe yoga isn't their thing, maybe they struggle with yoga for whatever reason, that's okay. They just need to find the physical activity that works best for them. Yeah. So yoga is wonderful, but actually yoga is not necessarily better than any other activity.
Okay. So you're saying as long as they're moving.
As long as they're moving, as long as they're physically active. So that's the really, really exciting thing about inflammation is, yes, it plays havoc on your body. I've had chronic inflammation before. It's very, very, very challenging. And often it's like a hidden disease. I could look healthy on the outside, but feeling terrible. Brain fog, complete lethargy, low mood, all the things. So, but the exciting thing is that we're now realizing how we can go about tackling it, which I think is very, very exciting.
I think what happens is we don't know how to catch it, right? So identifying things like brain fog, low mood, just that inertia of not wanting to do anything, what in Ayurveda sometimes they would call tamas, is reminding me of that. Are there any myths or things that we say in the wellness and yoga world about inflammation that need clearing up? because every day I think I see 10 different new videos on eat this for inflammation, do this for inflammation. And even if I don't have inflammation, I'm getting it by just watching that. Anything that you see that really you're like, you roll your eyes and you're like, oh my God, I wish they would stop.
Yeah, I think just again that idea that it's bad. That's like inflammation's a bad thing. Remember, it's an important part of our immune response, and this is why also let's say I was to sprain my ankle today when I'm hiking. The latest research tells us not to put ice on it and not to take an anti-inflammatory like ibuprofen because you want the inflammation to take place to heal.
Mm-hmm.
Now, yes, if the pain is persisting a week or 2 weeks later, yes, ice it and take the ibuprofen. But in the short term, we actually want the inflammation to be happening to help us to heal. So I think it's that kind of idea of it being kind of black or white. I think there are probably more myths to do with pain, and obviously it's all wrapped up here with inflammation. I think the biggest myth in the wellness world that I see about pain is that there are, let's say for back pain, that there are specific exercises that are more effective than others at helping your back pain. And this is where core stability comes into play. What's fascinating is core stability is everywhere. Okay. It's this multi-billion-dollar industry. It only came about as a concept in the late 90s. You know, it's not something that has been around forever. It's this kind of modern concept, and it's not really evidence-based. Okay. So you can have the strongest core in the world and experience back pain. You can have the weakest core in the world and have no back pain. Now, and interestingly, you can have back pain, you can do core exercise, and your back pain can get better, but it's not because of the core exercise. It's the fact that you're being physically active. So again, I think the myth is that, oh, if you've got this or this, like do this specific thing. It's just about being as active as you possibly can be. I think that's one of the main things. And then the other bugbear that I have about pain and the wellness industry is actually around posture. It's really interesting. The idea of good posture, it's a social construct. Like it is not evidence-based. So again, it is a multi-billion-dollar industry. Ergonomics, like setting people up with these desks,
standing desks, and these chairs,
it's a lot of people make a lot of money from it. It's not evidence-based. There was this really interesting study that looked at a particular industry, and it looked at the incidence of back pain. Okay. And then they went in and did all these interventions. So they did all the ergonomic chairs and desks and the screens at the right height. They gave people all the advice on picking up heavy objects, you know, do it with a straight spine, hinge at the hips. All this advice was given, how to sit and stand. And then after this, let's say 6 months after all this intervention, they looked at the incidence of back pain and it had not improved. Okay. What is more likely to impact whether or not you're experiencing pain at work is job satisfaction and not actually what you're doing at work. It's really, really interesting. So there's no way to sit or stand that is going to prevent you from getting back pain. I'm not saying that posture isn't important. I can sit slouched and feel pretty flat. I can sit upright and after a few minutes feel buoyant and uplifted. The way you sit and stand affects your breath and all these things. I get it. There is validity there. But I would say instead of worrying or putting too much focus on how you sit or stand on a regular basis, just try to move more. So if you have a desk job, it's not like the perfect way that you're aligning yourself while you're typing, but it's like take a break every 30 minutes and walk around the office, do some chair yoga, do a breathing practice, and then get back. So it's breaking up like sedentary lifestyle with movement. We have evolved to move. We have not evolved to sit or stand in any one static position. So I think that's one of the biggest myths, that it's your posture that is causing back pain.
No,
it's just not evidence-based. It's really, really interesting.
It's fascinating to me that it's not evidence-based, because you see so much, right? The hazard of sitting and things like that keep flashing. So to close things out, is there any final thoughts that you want to leave yoga teachers with when it comes to pain and or inflammation, and help them to recognize it and maybe even work with it in yoga spaces or in their own lives?
Yeah, I think, we talked about a little bit about the kind of general symptoms that someone can have if they are experiencing chronic inflammation. So I think it's just recognizing how important it is to be providing people with these tools that we're providing them with. Simple meditations, simple breathwork practices, simple sequences that they can do at home, that they could do in bed or in a chair, or it's the simple things. We don't have to reinvent the wheel. I think we just have to give people tools that they feel confident to do at home on a regular basis. And I think it's also playing with the idea of slowing things down, because sometimes when someone has brain fog or feeling lethargic, slowing things down or restorative practice can be helpful. But sometimes the thing they need most is to actually move a little bit more vigorously. So not to always think, it's the slow styles that are going to be helpful for these people, but it's like whatever it is that's going to get that person to move, is going to be key. And for any listener out there that is dealing with inflammation or pain, just try to show up for yourself every day. And even when you're not quite feeling like it, take a brisk walk around the block, move your body in the way that you can, think of all the things that lift you up, spending quality time with people, cooking your favorite meal, taking that bath and lighting the candles, whatever it is. And just try to show up for yourself every day in the way that you can. And, the chances are you're going to start to feel a little bit better over time. So yeah, I hope this has been useful for people. I hope it just changes people's mindset a little bit,
I think it's extremely useful. And I was thinking of this quote as you were sharing that, and it's from this book. I'm not able to remember the title of the book. It'll come to me right after we stop recording. It says, when you're losing your mind, find your body.
Yep.
And I think it's the simple advice, Andrew, that is so important. And like you said, we don't need to reinvent the wheel. It is really these small, simple day-to-day things that we should be doing. The question is, are we doing it? So this is very helpful. And I know there's a lot more out there about pain and about inflammation, but this is a wonderful jumping off point into these conversations. Thank you so much for being here and doing this. I hope you come back to get nerdy about some other topics in future too.
I'd love to.
But thank you so much.
Thank you for all your wonderful questions. And yeah, it's been really, really great talking about all of this with you. Thank you.
Thank you. Thank you so much for listening to the Let's Talk Yoga podcast. Make sure you are in the know-how by being on our monthly newsletter. The link to that is in the show notes. I've also linked all of Andrew's socials, his courses, as well as his website in the show notes at letstalkyoga.com/listen. Until next time, take care. Bye-bye.